So for questions about nosebleeds, we talk about nosebleeds that are originating in the front of the nose and then those that are originating a little bit farther back. When we're concerned about the nosebleeds happening in the front of the nose, that divider that separates the nose into two sides, which is called the septum, there are a small network of capillaries, small blood vessels that sit right along the septum, and those vessels can rupture and then bleeding can occur as a consequence of dry air or lack of humidification, being on blood thinners, trauma, whether there's a fracture or some trauma from even a sharp fingernail like what we have listed here in our information for you. And so the best thing that you can do in the instances where bleeding is coming from the front of the nose is to keep the nose moist, to use humidification, to use saltwater sprays, saltwater-based lubricating jellies, avoid trauma to the nose, avoid really strenuous exercise while the area of the nose is healing, and try not to dislodge the scab that forms prematurely because those bleeding episodes can recur. For the bleeding that happens farther back in the nose, on the other hand, that one typically will require some type of an intervention from a physician, whether it's an otolaryngologist, those of us who specialize in managing problems in the ear, nose, and throat, or someone in the emergency department or even your primary care physician. You should seek medical attention for those nosebleeds that are occurring in the back. We may have to go in and put packing in the nose or use some type of instrumentation to cauterize a blood vessel that's farther back, and then also inspect the nasal airway with some type of instrumentation, usually some type of a scope, to make sure that there aren't masses or growths or tumors or some other abnormalities. Even some unusual blood vessels can form in the back of the nose that you may have had your entire life, but for whatever reason didn't cause you problems until such time as this nosebleed occurred. And so when evaluating nosebleeds in general, whether it's coming from the front or the back of the nose, look at what your overall health is from the standpoint of smoking or your blood pressure, if it's not well controlled, if you're on blood thinners, because those things can also contribute to either the frequency or the severity of those nosebleeds. Feel free to scroll through our website for additional information, and there are many other board-certified professionals in the field of otolaryngology waiting to assist you. Click the Find an ENT button to find a specialist near you.